Selena, thank you so much for also joining us. I know that you and your team are also going through a particularly busy time, as everyone is. But we also know, so when a couple of us at Health Consumers Council learned about the COVID Care Assist team, that we were really keen just to help spread the word to make sure that people who might be able to access this extra support can find out about it. Now, just to be clear, when you heard Grant talk, so Grant spoke about the COVID Care at Home programme, and I know that we shared in the chat a link to how you access that. And Selena, please do feel free to correct me, but my kind of lay understanding of the difference between your service and that, which I know that we'll explain in a lot of detail, is that COVID Care at Home is looking at the clinical aspects of the extra support that some people might need, whereas the COVID Care Assist team is looking at some of the non-clinical aspects. So please again, join me in welcoming Selena West from the COVID Care Assist team, who's going to give us a bit of an overview, and then we will put questions to her as they come up. Selena.
Hi, thank you for having me, Claire. I'm going to share my screen so that you can, I've got a PowerPoint presentation if it comes up. And of course, best laid plans.
Well, if you're having trouble, I've got the slides that you sent. I've got the PDF that you sent across. We could put that up if you're.
No, just
you keep going with that now.
Did that come up?
Not yet. So over to you, Selena, for us to hear a little bit more about the COVID Care Assistance team.
Yeah, hi, thanks Claire for having me on today. Thank you, Grant, for your presentation. That was really informative. There are some things that I'll be able to take away to give to the team this afternoon, which is always really helpful. So I'm here today to talk about the COVID Care Assistance team, or CAT, or CCAT, as we're called here at FOPS. So COVID Care Assistance team provides a social support response to the community. And I'll go through the differences between COVID Care at Home and COVID CAT in a little while. So before I do begin, I'd like to acknowledge the traditional custodians of the land on which we're meeting today, the Whadjuk people of the Noongar Nation, and pay my respects to elders past, present and emerging. So a little bit about, so COVID Care Assistance team sits under Public Health Operations, or FOPS as we're known here. So Public Health Operations is a statewide response. So the COVID Care Assistance team is also a statewide response. So we sit with the Public Health Registrar for the clinical review of COVID positive cases and close contacts. Underneath there, we have the surveillance officers who do the contact tracing of confirmed positive cases. Then we have the new cases and ongoing management, home isolation for interstate travellers for positive cases, epidemiology and education. So under FOPS, we have quite a lot of responses for community. We also have sitting here the State Welfare Incident Coordination Centre. So that sits under the Department of Communities. With SWIC, as it's called, SWIC offer accommodation, food and provisions, which excludes alcohol and tobacco, personal supplies, so clothing and hygiene items, etc., nappies and sanitary items. If somebody discharges from hospital with no clothes, they can provide some personal items as well. So we also have FEOC, which is Public Health Emergency Operations Centre. So underneath FEOC, we have surveillance, quarantine management, training and workforce, public health intelligence, public health planning and communications. So all of our communications out into the media comes through FEOC. Infection control management and the admin side of things. We also have SHIC. So SHIC is the State Health Incident Coordination Centre. Underneath SHIC, we had the surveillance team, state health planning development, return travellers from overseas, state health community release, quarantine management, state operation controls, and the communication cell. So SHIC have the quarantining hotels that come, so the return travellers coming in from overseas, they would have spent 14 days in isolation as a return traveller, but now they do 7. So I'll go to the next slide. So COVID Care Assistance Team, or CCAT, is a community response. So our scope is social support to community members isolating in communities and those isolating in SWIC managed hotels. So if there's somebody in the homeless population or somebody who doesn't have a safe place to isolate as a COVID positive case, they can be referred to SWIC for hotel accommodation, and we will monitor them whilst they're in that hotel accommodation. So under SHIC, we have the health and wellbeing team, which is the hotel quarantine. So they're SHIC managed hotels, and their scope is the social support for community members quarantining in SHIC hotels. So if we have somebody who may not be able to isolate safely, they may be able to stay in a SHIC hotel, but that depends on the state health space. So the SHIC hotels for overseas or returned travellers, they have medical supports in place. So they have a medical team on site 24 hours a day, and they also have security. So if in the quarantining hotels, they have a very secure space that people can isolate in. Whereas in the SWIC hotel accommodation, we don't have those supports, unfortunately, but hopefully that could change, who knows. So the COVID Care Assistance Team was born in 2020. So a work colleague and I came across to Public Health Ops in 2020, and we actually put this program together at that time. So we put the surge strategy in place for workforce and for escalation of a community response for the vulnerable groups. So we put that together in 2020, and I certainly went to the swine flu pandemic response and took recommendations from there. So in writing our response for COVID, we looked at the swine flu, which was sort of one of the more recent pandemics, and the operations were very influenced by the recommendations of the swine flu. So what the COVID Care Assistance Team does, it provides a collaborative approach to address the social supports for close contact and positive cases whilst isolating as recognised through public health operations. So as a positive case, and I'll go more into this in a little while, you have to be registered into public health operations before you can have assistance through the COVID Care Assistance Team. The development of COVID-CAT includes a culturally appropriate response to identify community members within the Aboriginal and CALD communities. So anyone with complexities who may require additional support during isolation within the community. So our aim is to increase capacity for assessing and providing an appropriate community response for COVID-19 cases to minimise the risk of overburdening the hospital system and non-compliance with isolation recommendation requirements. So COVID-CAT community includes, so our assistance is social and emotional wellbeing, lots of mental health support, drug and alcohol support, domestic violence, medication, so people who have regular medications who may not have enough while they're isolating, we link them back into their GP. If they have a really good relationship with their pharmacist, We can get the medication script sent to the pharmacist, and then the pharmacies have been actually delivering the medications to different people in community, which has been really good. Disability, homelessness, and chronic conditions. So our referral pathways. So as somebody has a COVID test, so if somebody requires testing, they may do a RAT, or they may have a PCR, which is done through pathology. So a RAT has to be registered as a positive case online. So you can go online and you can register that yourself, or you can have a family member or somebody else. Doble are actually registering RATs online for people at the moment. So you have to register the RAT online. That will come into focus, and you will be sent a survey link, which you can, and you have to answer some questions from that survey. From pathology, a PCR comes straight into public health operations, and it registers a positive case. And as it comes through the system, people are interviewed by the surveillance officers or people who are entering their information on the survey. That will come through into a task, into a queue for CCAT, and we'll monitor the queue, and we'll identify what support that person's what support they will need whilst they're isolating. So from focus, we identify what support they're going to require. So the CCAT social support is, as I said before, so the social and emotional wellbeing, mental health, domestic violence, drug and alcohol, disabilities, homelessness, and chronic conditions. So the referrals come through to CCAT through our queue or through the dashboard via our public health operations focus, or it's Salesforce, which is where we collect all of the data. We identify the support that is required. If it's a homeless situation, we'll refer through to the State Welfare Incident Coordination Centre. If it's a welfare provision that they might need, so people may require food. We've had lots of families contact for food assistance while they're in isolation. SWIC aren't public health, so SWIC certainly are. They're a standalone service, and it's offered through the Department of Communities, and we refer straight through to SWIC, and they do assessments, and they will contact the person, and they will decide on whether they're actually able to provide personal requirements to that person. Even though we refer those provisions off to SWIC, we continue to provide the social support. So if somebody has mental health issues, or if there's somebody in a hotel quarantine situation, CCAT will continue to provide support to that person. And we will refer them back into their primary health providers. We refer them back into their GPs for telehealth support. If it's a drug and alcohol situation, we link into other organisations to provide counselling to that person while they're isolating. If it's a homeless situation, we have links into homeless healthcare and all of their provisions that are in community. With disabilities, we link them back into the NDIS provider, and there was a question on carers in the community. So if you know of an elderly person, or if somebody you know of requires support from a caring situation whilst they're in isolation, I would suggest that they actually go back to their carer and ask them what their COVID policies are. So asking what COVID policies are through each of the organisations. There's many organisations that will provide support, but it's really a good idea to ensure that you know exactly what your provider is going to provide you while you're isolating, because then you're going to know what to expect. So if you have a couple of hours care, or if you have 24/7 care, you know that you're going to be able to have that same care while you're isolating, or your family and friends are isolating. That's a really important thing to do. The State Health Incident Coordination Centre, they provide the social support for overseas travellers. So there's a group of staff who provide health and wellbeing to the quarantining hotels. So they're quite separate. So there's three different areas. So the COVID care assistance team, the state welfare incident coordination team, and then the state health coordination with the health and wellbeing team. So COVID-CAT provides community support to close contacts and confirmed cases in community. So what we do is we, once a referral comes through into focus, I have a team of staff. So in the last 8 weeks, I've been able to stand up 13 staff members, and they're social workers, mental health trained, welfare workers. I have complex care coordinators with trauma experience, and lots of mental health trained staff. So what the staff do initially is contact the person, and they do a 3-point ID check, and they discuss what the COVID care assistance team role is, and they gain consent to act for that person, especially if we need to contact other service providers. So we provide assurance and just make sure that people understand why they have to isolate. So the reasons behind the isolation. We make sure that if they have other families that need further assistance, we can assist with that as well. We provide education and resources, not just to community, but also to the surveillance officers here. We have different days, we can have up to 170, 180 surveillance officers doing contact tracing. So we provide education and support to those staff members as well. And we provide culturally appropriate support. So we have Aboriginal staff working on the team. We also have other staff from CALD communities. So we have CALD background. So we're able to provide a very cultural support. We've had resources translated into different materials, into different language. So we can provide some translated information as well. And we link into translation services if we need to do that. So the next step is to assess and refer and connect. So we do a risk assessment, and we do a referral, and we identify further support options. So we discuss with the person what their current concerns are and possible solutions whilst they're isolating. We identify welfare needs and medical needs, and we discuss ongoing support that they may have once our services cease. So we provide that support to people for the 7 days that they're isolating. If the person's still symptomatic on their last day of isolation, they will be required to stay in that isolation, and we provide support. So we've had some people that have been isolating for 25 to 30 days, so we can provide the support the whole time that they're there. We monitor and support each person, and we look to see what their services in the community and what their contact looks like. We connect people back into the community, and we follow up. We provide follow-up calls, and we put all of that documentation into focus. So if there's anything that requires further review, we can go back into focus, and we can see what other staff members have put in. So we're a 7-day service, and throughout the 7 days, I have a roster process where staff are rostered on at different times. We always have a senior complex care coordinator on board, and then we have the screeners, which are here all the time. So with the documentation, we confirm that everything is in focus. We have the patient linked into supports and other appropriate services in community. We look at any referrals that need to be completed, and that's for food and accommodation and other services. We make sure that we have that consent. We look at any required follow-up that they may have. So we're always linking into GPs for our telehealth appointments. And we also link into Covert Care Assistance, the Covert Care at Home, which I'll discuss further in a little while. If we have complex care with any of the people isolating, the complex care coordinator will become involved and they will provide extra support. We also have the clinical nurse managers here who sit with the surveillance officers. So we have the clinical nurses that we can take guidance from, and we also have the public health registrars who we take guidance from. We look at any really important issues, and if there's important issues that staff in the screening teams can't assess, they will need to be raised with the team leaders. So we have resources that we've developed in 2020. They're available on the Healthy WA website. So you can go on to Health WA and these resources are all available. The ones in language should be on there as well. And there's also some for regional and remote. So there's the wheat belt, the goldfields, the Pilbara, the Kimberley, resources for local metro area. Did I say the goldfields? So yeah, so there's quite a few resources available on Health WA website. So with the Covert Care at Home program that Grant discussed earlier, so Covert Care at Home, I think it was, it went live on about the 13th of February. So before Covert Care at Home went live, we developed a referral process between Covert Care at Home back into the Covert Care Assistance team and from Covert Care Assistance team back into the Covert Care at Home team. So if somebody goes onto the webpage and registers for Covert Care at Home, somebody with complex medical conditions, they will provide consent to that service. It's a free service, so you can go online and you register into it. You can actually have other people register you into that service. When somebody comes into Covert Care Assistance and they need that further follow-up with medical and clinical, we will refer people in. So we'll actually go online for that person and we'll refer them into Covert Care at Home. And that's to ensure that they get all of the wraparound services that we have available to work in really well together. Covert Care at Home then will link people back into the Covert CAT or into Covert Care Assistance team here in Perth for their social and emotional wellbeing, for SWIC referrals into accommodation, for food referrals. If there's domestic violence issues, Covert Care at Home will link back into Covert CAT to ensure that they have as much support services in place as possible. To register into any of these services, a person must have a positive test. If it's a RAT test, you can go on and register that online. But you must have either a PCR positive or a RAT positive test. And as it says there, other people can complete this registration on behalf of the client. We've had a lot of, we've had quite a few community members linked into Covert Care at Home. If somebody is pregnant, they can link into Covert Care at Home. If somebody has complexities, immunocompromised, people who need further support from medical teams. The Covert Care at Home staff are located in the eastern states, so they do link back into us if people require medication, and we can link them back into their doctors and into pharmacists in community. I think, yeah. So that's pretty much the other program that isn't on here that we do link into. So at Royal Perth Hospital, they have the Covent Navigators. So people discharging from hospital to home as a positive case or to a hotel situation as a positive case will also be linked into the Covert Care Assistance team. So we have a really good relationship with the navigators at the hospital. And they will, if they have a complex person that requires further follow-up and support whilst they're in isolation, they refer that person through to CCAT. And if they have medical complexities that need further follow-up, they'll refer into COVID care at home. So we have a really good, consistent wraparound service, which sort of focuses on the health and well-being of a person, the medical requirements of a person, but also with the navigators from the hospital, we make sure that we provide as much support to the person that's isolating as we possibly can. I have a registered nurse in the COVID care at home, COVID care assistance team. I'm getting all my words muddled up now. We don't provide medical support. We provide social and emotional support. We don't provide medical information to people. We certainly ensure they link back into their doctors. They link in and have telehealth appointments. We link them into the people that are going to offer the most assistance as we possibly can to that person isolating. I think that's about all I have on that.
Well, Selena, thank you. Again, it's a very informative and very thorough presentation. We have had a couple of questions come through. Now, I know we've only got 10 minutes left, so we'll try and be quite concise. I will try and be quite concise, which might be a struggle, but I'll do my best. Thank you so much. It's very informative, and it's great to see, if you like, all of the various pillars of support that are available to people and hear how they're all talking to each other. We did have one question early on. Is this a service how does this service appear or is experienced by people who live rurally or in remote areas?
So what we have in the rural and remote areas are the REOCs. So we all have acronyms.
Oh, absolutely.
So the Rural Emergency Operations Centres, there's different areas that people can link into. If we have a referral come through, and we have had a referral recently for a person isolating as a positive case, and that was on the border of South Australia, the Northern Territory and Western Australia. And from the community, apparently you can walk out and put your foot on the peg that divides South Australia and Northern Territory. So it was a very isolated little community. The screening officer, we sat down and we discussed that person's particular isolation requirements and everything. We linked them back into their providers on country. They're the people that are going to be able to provide the best care for, especially in regional and remote areas. We link back into the Kimberley. We have contact details for all of the support people in those areas. So we make sure that we link into them. If we provide any assistance at all, we send emails through to let them know what assistance is provided. We have constant linkages into WACS, Western Australia Country Health. So we make sure that we're always sort of discussing different cases and different things, different processes. And as you can imagine, COVID is very flexible. There's no one rule. Every single day we have changes, and we just have to make those changes. As soon as we walk in the morning, we just have to look at what's changed overnight, and we have to put those processes in place. But we've got some really good, we've got some good pathways into the regional and remote areas.
That's good.
And we are certainly a statewide situation. Yeah,
and it's great to hear. I know that it would be, it's a very changing environment for your whole team to work in. So there's a lot, there's a lot going on for everyone. There are a few questions coming in about how people hook into the service. And so we've had a couple of people who have said, oh, look, I've had a positive result and I've had the text, but I didn't complete the survey because it wasn't completely obvious what it was about. I know that we have spoken about this, and I understand that there might be some limitations. in terms of the message to the community, and so for everybody on this call, a message that they can then take back to people in their networks, what's the practical way that people can be sure that they are finding out about and getting access to this service as soon as possible?
So to link into Covert assistance team, you have to have a risk. So we don't contact absolutely everybody, especially with the numbers now, and in the next couple of weeks we're going to have even higher numbers. So people who come through with complexities, who need obvious help or support while they're isolating, we'll try our hardest to get onto those people within the first 28 hours. So to link into the service, if you complete the survey messaging, the first two questions, the first question is, are you Aboriginal? And then the next question under that is, do you require support within the next 48 hours, or do you require any social support while you're isolating? Those risks will come through to Covert assistance team.
Thanks.
So that comes into a dashboard that we have, and we identify, and we go in and we try to identify the people with the most complex requirements. If it's a homeless lady with 4 children living in a car, she's going to take precedence over somebody who doesn't have as high needs as her. If the person's been interviewed through the surveillance officers, they will provide extra text and comment in the survey. There's nowhere that you can put text at the moment. We are looking at changing that. As you can imagine, each survey only has so many characters, so you can only put so much information into that text messaging or into that survey. Once you answer that survey, it then comes back into public health ops and it goes to the required areas. So that certainly comes straight back through into CCAT.
Great. And so just to be really clear that to people, so when you get a text, and I think somebody mentioned, it said something about, complete the contact tracing survey. That's the survey you mean, isn't it?
Yes.
It's basically the message we want to get across is, if you get a link to a survey, fill it in.
Yes.
Because then the other processes will be determining who then, who's then contacted in what priority. So that's right, isn't it? So they get that SMS, will have 2 links, fill it in.
Yes, absolutely.
And tell everybody to do that.
Yeah. And, if we have had some people that haven't been able to fill in the survey, and they've had other people complete it on their behalf. So it's not, things aren't always easy, but certainly trying to make things as easy as possible for the consumer is what we're here for. Linking people back into their primary health providers if they have them available to them is also what we do.
Yeah, thank you. Now, I've seen that there's a question in the chat about some of the rules around close contacts and isolation. That's not something that we'll be able to cover today, but we will send out an email with some links to the information, noting, of course, that the question is about the fact that you're finding the information a bit confusing. So we'll try and get you an answer to that outside of this. Just to clarify then, Selena, so anyone in Western Australia can access the CCAT service, regardless of visa status?
Yes, it's a free service.
Yeah.
But they have to have identified risks.
Yeah.
If it's somebody who, there has to be identified risk. We just don't have the capacity to follow up on every single referral. Yeah. I will be recruiting further into this space, but certainly we've got 13 staff at the moment, and we're working from 8 till about 6 each day. There's normally somebody here until about 6, and that person is normally me. But most staff are finishing earlier than that. And with the complexities that we do have, we have processes where staff debrief in the afternoons, and we sit and we talk about and discuss the cases as well to make sure that staff are self-caring It's quite a complex area to work in.
It is, Selena, and I was just really thinking that. I mean, when I heard, when you're talking about you've got complex care teams, you've got clinical teams and others that you can draw on. I think what this has reminded me of, which I know has been talked about elsewhere, is that around the world, adapting to COVID has meant that we've really identified some of the pre-existing gaps in some of our systems and processes for people who are perhaps at risk of isolation or at risk of or are particularly vulnerable for a number of other factors. And I hope that what we learn through this process and the experience that your team is having means that, as Grant sort of flagged, that we might be anticipating, other waves, is that we're able to perhaps plug some more of those gaps earlier, so that fewer people are going to need a service like yours. I'm conscious that we're in the last 2 minutes, Selena, and so there was a question, and again, I don't know if it's something that you can comment on, in terms of how information, you mentioned before, I can't remember, I can't remember which of the teams it was, but there's a team who's responsible for getting information into the public. There was a question about how are the health department or the government making sure that these messages, in addition to things like this, which we're very grateful that you've done, in addition to things like this, how is it possible? What do you know about how the community is finding out about these services? Be that somebody who's not plugged into a general practice, they're perhaps living on the street, they maybe don't speak English as a first language, they might not have a smartphone. Is there anything you can tell people about how that's being communicated externally?
So with regards to the messaging, so our communication teams put together the messaging for the media releases and that sort of thing. So that certainly comes from the Public Health Office into communications, and the Chief Health Officer also has a lot to do with that space. We have the Healthy WA website where you can get your resourcing from. Not everybody does have access to computers, of course. There is messaging in the media. So there are some ads and bits and pieces that have been put out. The Aboriginal Health Council of WA has information available, and they are always updating that information and sending it out to community. They've got some really good information and resources on the rats available in community. So the 10 rats that people with concession card holders can access. So they certainly have that. Most AMSs and doctors' surgeries will have information available. So even if you aren't connected into a primary health provider or have a carer of any sort, there is lots of messaging out there. It's just a matter of, I think a lot of staff within East Metro in my other teams, they provide information to, sorry, I'm being kicked out of this room. I send a lot of information through to them and they send it out into community. So it just depends on where you're at and who you have access to. But there's information on COVID in lots of different places.
Thank you, Selena. And I know that what we're always encouraging people who take part in these sessions to do is that you now consider yourself a channel for that communication to reach out into everyone in your networks, be they professional, community, or otherwise. I know personally I've been sharing this in a local community Facebook group, which just where I live, and it's been hugely appreciated. But before
Facebook
Selena
is my enemy.
Facebook's your enemy. Well, there are some things that it does quite well, but I understand why you might think that. But please, everyone, join me again in the traditional Zoom way of saying thank you so much, Selena. Like you've described, I can only imagine just how very busy you are, and I know that you have a lot of things coming at you, and we really appreciate you taking the time to help spread the word about such an important service. So we wish you and your team all the best, and undoubtedly there will be more questions, but already some of the comments coming through how very informative people have found it. So we really appreciate your time and the work that you do.
Yeah, thanks so much. I have to get out of this room, but thank you so much for having me.
No problem.
The rooms are very scarce here.
Indeed they are. Yeah, no problem at all. Thanks,
Thank
Selena.
you. Okay.
Thanks, everyone.